Pros and cons of dental veneers. So if you clicked on this video, chances are you've seen celebrities that had great results with veneers, and so you're thinking, is that right for me? Hi, I'm Dr. Langston. I'm an experienced prosthodontist and the director of Dental Implant Aesthetic Specialists in Brookhaven, Georgia. And in this video, I'm going to share with you the important positives and negatives and reasons why you may or may not want to choose dental veneers for your treatment. So let's briefly recap what dental veneers are. Dental veneers are essentially thin jackets of porcelain that go over the front of teeth to give the appearance of aesthetic natural teeth. Some of the advantage of these is to minimal reduction. So we just take away a little bit of tooth structure that allows for us to have the adequate thickness of ceramic to give the appearance of a beautiful smile. I like to explain to my patients that veneers are very similar to press-on nails, and that they're a thin jacket that you bond to the tooth structure that gives the appearance of a nice healthy tooth. They're more durable, they're much more aesthetic, but it's the same premise that we reduce some structure and we adhere the porcelain to the tooth. Veneers are a great treatment option for teeth that are pretty much in the right location, are definitely healthy, maybe have a little bit of discoloration, don't need to be reduced down for crowns, but need more than just some tooth color bonding. So if you want more detailed information about the process of getting veneers, click on this video, The Beginner's Guide to Veneers, and I'll walk you through it. Con number one, there's little room for error. This is true. Once a veneer has broken or chipped, it's very difficult to repair in the mouth because porcelain needs to be made outside the mouth and bonded in place. The most important aspect to prevent this from happening is proper planning. Proper tooth reduction, smile design, making sure that the edges of where the veneer meets the tooth aren't under a lot of force. These are all factors that we take into play to prevent this from happening. Con number two, popping off. The dental veneer actually becomes dislodged from the tooth. One of the downsides of veneers is that they are just adhesively bonded to the tooth. Unlike a crown, which goes around the tooth and has natural retention, a veneer relies solely on the adhesive bond to keep it in place. So to avoid this from happening, you need to make sure that the veneer is bonded and not in a direction opposite to where the forces are coming in the mouth. Many of these factors that cause that veneer to dislodge or pop off can be avoided by proper planning. You don't want to put veneers on teeth that are heavily restored because you can't bond. There's not a lot of tooth structure to bond to. You don't want to put it on teeth in someone who is a grinder or a bruxism because they generate so many forces that you're going to overwhelm the bonding strength of that cement. You also don't want to put veneers on short teeth. Because these veneers require surface to bond to, shorter teeth are much more difficult to get that adequate retention, and those are cases that we do see veneers tend to pop off more than we'd like. Con number three, mix match. The color of the veneer doesn't match your teeth. One of the most difficult things to do in dentistry is to do a single veneer on a front tooth. The reason for this is because to match that one tooth to the natural dentition is very difficult, especially if you've got different color shading, different shapes and sizes. So for that reason, a lot of times we will do a complete smile analysis, take a look and determine that it might be best to do the two front teeth so you've got symmetry. Sometimes we do the front four teeth, and actually the most common veneer case is from canine to canine. Basically all those teeth in your smile zone, if we can control them and design them all at once, we can give a uniform aesthetic appeal. Sometimes it's necessary in certain cases. Your Julia Roberts, the people that go all the way back and show teeth, we can expand back to the premolars. But every case is different, and that's why we like to do a full smile analysis and make sure we provide the right veneer treatment for you. Con number four, sensitivity. Your teeth might be sensitive to hot or cold afterwards. Unfortunately, this is a reality. Anytime we do any kind of procedure where we're removing tooth structure, you always take away a little bit of that protective layer of the tooth over the nerve. The big advantage of veneers is not only are we very minimally reducing the teeth, the goal is to keep that bonded layer and that outer enamel surface layer. So sensitivity does happen. And the biggest time that we have that sensitivity is usually the couple weeks after we prepare the teeth. And the reason for this is because we've reduced some tooth structure and you have temporary veneers on that don't create as good a seal as the final veneer. Once we put the permanent veneers on, everything is sealed off, everything is closed. There's no areas for that underlying tooth structure to be exposed to cold or hot in your mouth. Sometimes it takes a while for the tooth to calm down. In order to bond the veneers onto the tooth, we have to use chemicals. And sometimes the teeth don't like those chemicals, and it takes a while for them to kind of settle back in and recover from the trauma. Of course, with all this said, we've covered the cons. Let's talk about the benefits. Veneers are a wonderful treatment option, and we love doing veneers. The results are amazing, and people are always happy. Make sure you subscribe to our channel for more videos to help you watch your mouth. So let's talk about the pros. Pro number one, veneers are a great solution for minor cracks, minor cosmetic defects, minor discoloration. These are all things that can be covered up and camouflaged to give the appearance of a beautiful smile. Also, if your teeth are discolored and whitening is not an option, veneers are a great solution for totally covering up and masking the underlying tooth structure. Pro number 2, they look and feel natural. They're by design, they're made to look like your natural teeth. We don't want you to look like you've got a big fake set of teeth. So the thin layer of porcelain allows us to give you a very lifelike look. One of the other advantages is with a veneer, we only cover the sides and front of the tooth. So your natural tooth is on the back side, remains untouched. This allows your bite to maintain how it is. So when you leave, you bite just the same as you were when you came in, and so everything feels a lot more natural. You don't have to have an adjustment period where the bite doesn't feel right or something's hitting heavy. It's just your natural bite, but looks a lot nicer. Pro number 4, they're low maintenance. Like we discussed before, because veneers just go on the front side of the teeth, there's no change in the bite to get used to. Unlike implant crowns or bridges or more complicated procedures, we aren't creating any areas that are harder to clean. In fact, a lot of times with veneers, by design, we're filling those spaces and those food traps to eliminate that. So it actually makes your home care a little easier. Now, that doesn't mean you don't have to brush and treat your teeth like you did before, but it does mean there's not a lot of extra work involved to maintain that smile. Pro number 5, increase confidence in your smile. It is absolutely amazing what a set of veneers can do to transform somebody's smile. With minimally reductive procedures, 2 or 3 appointments, we can take someone from who's ashamed, not happy, embarrassed with their smile, to someone who is just beaming with pride. And it honestly can change your whole self-esteem and confidence. So a question we get a lot is, can veneers replace old crowns or cover up severely defective or broken down teeth? Unfortunately, the answer is no. Veneers are a great solution when you've got healthy teeth, when you've got minimal spaces. If you have an old crown, unfortunately, it just has to be replaced with a new crown. The nice thing is now we have ceramics that we use the same material to make the crowns and the veneers out of. So it's not uncommon at all for us to have a set of teeth where some are crowns, some are veneers. And the most important thing is our lab technician makes them all at the same time with the same materials. So from the outside and the appearance, they all look symmetrical, they look the exact same, and no one knows what's a crown and what's a veneer. So if you're thinking about getting dental veneers, please reach out to us at drbrettlangston.com. That's drbrettlangston.com, and call us for an appointment. After you get your veneers, the most important thing is taking care of them so you get the longest lifespan possible. Follow us in our next video and we'll show you how. I'm Dr. Brett Langston, and I'm helping you watch your mouth. Am I looking at the right spot? Like I'm looking right? That's okay? Okay, cool.
I'm just making sure. I didn't want you to be pointing.
No, I forget. I just do like a little disco. Hey, yeah, okay. All right, we good?
Yeah, I'm good.
Slap into a Slim Jim.
Yeah.